Welcome to the Operatory, the podcast about burying the dinosaurs in dentistry, putting those guys in the ground, moving past outdated procedures and technology to find a better way.
Are you having a word problem today, Brian? Dated?
No, I'm burying dinosaurs, man. That's Dave Pryor, our resident patient, perspective coming through the microphone. How are you doing today, Dave?
Good, Brian. How are you?
I'm doing well. I'm excited because we're part 3 of our 4-part series with the uncanny Dr. Brad Eli, facial pain specialist, bringing all sort of illuminating knowledge to the average general dentist, at least to me, this average general dentist. So part 3, so far today, we've kind of laid the stage, kind of letting our audience know that there is actually a specialty called facial pain providers that are seeing those patients that I'm not wired to see, I guess is to say, or giving people help that treating the untreatable for the general dentist population. On to phase 2, we had kind of how the routine general dentistry can actually incite TMD, facial pain. And now we want to dive into, if you don't mind, Dr. Eli, what the average general dentist should do if they have a patient that comes in, does a routine procedure, and then this patient is having pain at post-operatively.
So thanks for having me again. It's a pleasure being here in frigid Minnesota.
Even sitting next to Dave, it's a pleasure. Wow.
It's a pleasure.
Well, he's headed for warmer places soon.
Yes. Yes, hell. But
yeah. Beer hell. So the jaw and muscle sprain strain, we have put together all kinds of little monikers to try and help move this process along within the general dental population. As any other specialty in dentistry, our primary goal and our primary focus is to educate the primary dentist who sees the patient, kind of is responsible for the patient, and keeps track of the patient.
I thought you were going to say your primary role is to come up with monikers and acronyms, but okay, that's same thing.
So JAMS, jaw and muscle sprain strain. Mm-hmm. We came up with a device called the Quick Splint, and the Quick Splint is designed specifically for my general dental colleagues to get a person into a treatment as soon as possible. It also allows for the office to take an active role, versus a I don't know what to do with you role. And anyone who can be fixed in a general dental practice, I have no desire to see. I'm not going to run out of patients. And so any of the people who are, a TMJ specialist or people like that, or people who have those types of practices, should be pushing to try to get as many patients treated before they have to come see a guy like me.
So let me take a step back. So if you do have a patient who has JAMS, jaw
and muscle sprain strain,
exactly that. There we go. Then and that can be a consequence, as we talked about last week, of routine dental care. One way to either diagnose or possibly kind of treat it would be to use a quick splint, which I've used in my office for several years, but I had my first one made today. Had the most highly overqualified mixer of my VPS material. Dr. Brad Eli mixed it up for me, so thank you very much. You did a phenomenal job.
Thank you.
Yes, and it's in a few minutes, you have a quick splint that you can then. And so how would you recommend that the general dentist uses the quick splint?
So we have a lot of...
Which I should mention, sorry, you don't need to be a facial pain specialist to mix up the VPS.
No.
You could have the dentist doesn't even need to be in the room, right?
Correct.
Yeah.
if I had my way, the patient would be given information, which we have, and we make it available to every dentist for free. An information packet that basically is in the reception area saying, if you have a problem following your procedure, please let us know. It also has a questionnaire, so you can kind of be pre-warned that this person might have a little bit of trouble, so you might go a little slower on the procedures to try to avoid having them have a strain injury. Not to get into excruciating detail, but the very way that we were taught to do procedures in dentistry put the jaw and the jaw muscles at risk. Okay, so it's like putting a bad pair of shoes on a person and having them run stairs.
Gotcha.
The likelihood of somebody spraining their ankle goes up. So there's a lot of things that we've put together to try to help identify those people early. And then if they do get identified, it's not a dental follow-up. It is a office follow-up. So patient representative.
Yes.
You would call the office and you'd say, I had scaling and root planing done on my lower arch yesterday, and I'm having a lot of discomfort, and I can't open my mouth very far. Sound familiar?
Yes.
Okay. So rather than the front desk saying, oh, yeah, that happens, it'll clear up, take a couple of Advil, we would recommend that you be told, can you please come in right now?
Sure.
So what we've done is two very important things. Number one, we've said to the patient, your problem, we are interested in.
Yep.
Okay.
Are we we hear you,
Right.
and we understand that this
Right.
is an issue, right?
Second thing is that we will see you right now. And as an expert in this field, right now, as you and I talked about before, means right now. So that defines how big of a problem really is it for you. So if you have a big
sure.
problem,
Yep.
and we say we will see you right now, guess what? You come right now.
Right.
It's not my
Right.
son has a basketball game, so
Right.
I'll be there
Right.
tomorrow
Yeah,
at 7.
it's not convenient for me
Yeah.
right now.
Right.
Okay,
so if it's
right,
not convenient for you right now, then it's not that bad a problem.
correct.
Got it.
Correct.
Yep.
So then the person is asked to come into the office. The doctor doesn't have to see them.
Right.
The assistant simply takes a measurement of how wide they can open,
Yeah.
takes a survey of where they're having discomfort, and places a device called a quick splint in their mouth, and off they go with a set of home exercises to do, a hot and cold pack, and how to use a hot and cold pack, and a trail of, we want to see you back in 2 weeks.
Sure.
Right? So now what you have done is exactly what you would expect someone in a specialty field to tell a primary care provider to do. Person comes in, they complain of a sprained ankle, wrap it up, ice it, elevate it. We need to see you in we need to see you in 2 weeks.
Yep.
If in 2 weeks you're way better, keep doing what you're doing, and let's see you in a couple more weeks or maybe at your next follow-up. But you don't have to keep using this temporary device.
And I would guess asking the questions on the front end, right? And because let's face it, lots of patients, even ones who are maybe are at high risk of having jams post-operatively, they're going to be going, I'm fine. But at least you've set the stage for this is a possible consequence, and then if the patient does have that post-operatively, you can say, yes, we talked about this, and it's not an excuse, right? It's not, you're not then telling people, yeah, this is normal, it does happen, right?
Right.
And so asking the questions on the front can kind of serves two purposes. Hopefully you can prevent it, but if you don't prevent it, you've pre-explained why they may have this, right?
Right. I think, at the full extreme, it's called informed consent.
Ah,
Well, and
ooh, that's a novel concept, my friend.
certainly from my perspective, you're providing compassionate care, and so if I have mouth pain and you say take a couple pills that are over the counter, and it's like, no, it really, really hurts, and instead you say, can you get in here now, and it is a bad pain, then it's being addressed. And like you said, if it's addressed within 30 days, if it's addressed immediately, you've got a much greater chance of recovery. So, just like any sort of sports injury, that you're going to heal faster, you're going to heal better. And so from my perspective, I can absolutely see how addressing it in that manner would be really helpful to the patient.
Right.
Well, if you had a, let's say you sprained your ankle and you called your physician and said, I think I sprained my ankle, and they were like, take a couple Advil and you'll be fine, right?
Yeah.
That's
exactly the same.
That's
Find a new
exact
physician,
same thing.
right?
Yeah, exactly.
Right.
So just to kind of wrap up today's podcast, what we're really looking for the general dentist, the way to treat that jaw strain, jaw and muscle sprain and strain, jams, is to provide at least a temporary occlusal appliance like a quick splint, then give them exercises and hot and cold packs to help relax the muscles, and then see them in a couple weeks on a follow-up. Or how would you recommend that they follow up after that, or just come back if you still have the issue?
No, there's so the to use it most effectively, it is a protocol.
Okay.
So you don't want to put something in and say, this is it. So you wouldn't just think about it just like an ACE bandage.
Okay.
So the person comes to you, you say, if you sprained your ankle today, we can see you right now. Okay. So they come in and you put the ACE bandage on. Okay. The plan would never be we never need to see you again.
Yeah.
It would be, let's see you in a couple of weeks and make sure that you didn't crack a bone, that you didn't,
Sure.
because there is a clear separation, or what we call stratification. So treatment stratification is really the key to not only now, but the future of healthcare, which is you don't spend $10,000 on something you can fix with $100.
Yeah, completely agree. Yep.
So, as we move forward in a field like this, where historically it has been cost prohibitive to a lot of patients, we need to start to get to the place where we intervene early and we intervene simply and very cost efficiently.
I think that would be a great topic for our 4th episode. How the state of facial pain in dentistry now, and where you think we should go, what that stratification could look like. Because I view it, I think we should see that for next week. Yeah. Yeah. So thank you very much, Dr. Eli. Thank you, Dave.
Thanks, Brian.
Why, thank you.
Look forward to talking to you guys next week.
You got it.
For more information about TMD facial pain and how to treat these patients with products like the Quick Splint, go to quicksplint.com. I also want to remind you to rate and review us wherever you're listening to this podcast. And if you have suggestions or comments, please visit theoperatory.com and drop us a line. Again, I'm Dr. Brian Laskin, host of The Operatory. Thanks for listening. I look forward to speaking with you next week.